Well, hi, everybody. Welcome to Dr. Misha Kogan's mini podcast series. It's such a pleasure today to have our own Dr. Jennifer Rioux today. I keep saying Rooks, but it's not right? So X is
Thank you.
silent. Yeah. So Jennifer is a long-standing practitioner of Ayurvedic medicine. She's going to tell us all about it, but I'm really excited that she's recently joined GW Center for Integrative Medicine. And I thought it would be really cool to just have basic questions. What is Ayurveda and how does it fits with the larger context of integrative medicine and what are the conditions and all that? So with that, Jennifer, right off to you. Open us up however you want. Tell us a little bit about yourself, maybe a little bit about your journey.
Sure, absolutely. So, first of all, I just want to say how excited I am to be working with the center. I think it's a great place and has so much to offer. So, I'm excited about that. And as far as my journey with integrative medicine, um, it actually started a long time ago as I had an illness in my 20s, a very serious illness, and there were not diagnoses to be had for me, and Western biomedicine did not provide a lot of options. And so I began sort of as an autodidact trying to address that condition and studied herbalism and nutrition, holistic nutrition. And then I am trained as a medical anthropologist. So for my dissertation research, I studied the professionalization of holistic healers, Ayurvedic healers, and just became really aware of how the integrative medicine movement is a social movement that is really grassroots and patient driven. And that's where the change has come, is that patients were not receiving what they needed in terms of healing. So as part of that dissertation, I took initially just the first courses in integrative medicine to get a background, but then I was very hooked, and I then took the full course. And so I studied at the Ayurvedic Institute with Dr. Vasant Lad, who's a very internationally known Ayurvedic physician. And and so have worked a great deal with the National Ayurvedic Medical Association, developing the standards for Ayurvedic medicine that we have today. So I led that effort and initiative, and have also been very involved with the initiative for Ayurvedic yoga therapy, because yoga therapy as a discipline really benefits from having its indigenous medical context of Ayurveda to help understand causality and mechanism. And
Let's
so,
let's talk a little bit about
sure.
more about this, because I think a lot of people like have this idea that Ayurveda is like all this, you're just doing the diet according to your body type, according to your dosha, and that's it. But it's so much more than that.
Mhm.
And of course the yoga fits in here tightly. So tell us a little bit about this interplay between all these pieces. I think, what are they called, pillars? Like there's a term, right, in Ayurveda, how you describe each big component.
Yeah, so Ayurveda is a comprehensive system of primary care. It's 5,000 years old. It's tried and true. The research and evidence base is very good now in the peer-reviewed medical literature, even in the West and also in India. But yes, Ayurveda has 8 different diagnostic and assessment procedures. It is we rely on diet, lifestyle, and daily routine as central principles of the practice, but also herbal medicine, which is very vast and comprehensive, also manual therapies. And what a lot of people know about is Panchakarma, Panchakarma means the 5 actions, and it's detox and rejuvenation therapy, which is very useful for certain conditions. And there's Ayurvedic massage, there's Shirodhara, which is the application of warm oil on the forehead, which is very good for headaches and nervous system conditions and insomnia. And so you can and go on and on in terms of, the possible avenues of treatment and healing in Ayurveda. And Ayurveda treats acute and chronic conditions. I mean, if you have a car accident, you don't want to go to an Ayurvedic practitioner. That's kind of obvious, but for the vast majority of other conditions, Ayurveda is very helpful. It is a gradual system of medicine, and there's kind of a maximum medicine that the quicker the cure, the higher the cost. And so, as a gradual system of medicine, it has very few side effects associated with it, which is one of the benefits. So
I think
what else?
that's part why it fits so well in integrative medicine, because this whole concept of the slower you implement the change, the more sustainable it likely going to be versus take a pill, rapid shift, and then all kinds of negative consequences as a result of that. Um, so give the listeners a little bit of a flavor. So let's say somebody comes in to see you with a particular medical problem. And let's pick something. Let's pick diabetes, right? So very common condition, commonly treated in a, I'm actually sitting right now across our clinic in our main building, GW Medical Faculty Associates. Actually, this is a virtual picture, but right there, that's the that's the building I'm in right now, on this on the right side. And so, you know, we can prescribe medications, we can try to tell patients to lose weight and optimize the diet, but you know, successes of that are pretty small. So just give a flavor to listeners of what, how would you handle, like, what would you tell the patients? How would the process of treatment gonna look for them?
Right. So the theory of Ayurveda is that we always address root cause. So we are much less concerned with um, the which symptoms the person has than we are with who is the person that has the symptoms, right? So we want to understand the original constitution of the person, which is something imparted to each individual at the time of conception, and that's informed by environmental conditions and also the genetic material of parents, grandparents, etc. And then understanding that constitution, we then want to understand the imbalance. And we take both of those things into consideration. So when you take something like diabetes or metabolic syndrome, it's in Ayurveda we would refer to that as a kapha type condition. So typically it's associated with a kapha imbalance, but any constitution can develop a kapha imbalance. However, whatever your original constitution is, you're likely to go out of balance according to your predominant dosha. So if a person's predominant dosha is kapha, they're likely to go out of balance in the direction of aggravated kapha dosha. So we always treat and try to pacify the aggravated doshas. And in the case of diabetes, metabolic syndrome, overweight, we will definitely deal with diet, but we will also look at daily routine and lifestyle because the condition of the nervous system is so important in Ayurvedic medicine. It's very difficult to request that people make behavior change if the nervous system is, out of control and running on overdrive. The change will become much more sustainable if we treat the nervous system first. We need to create some stability in the nervous system in order for the change to take root. So, but also because people are able to establish change gradually over time, able to understand their original constitution and their imbalance. There's a lot of patient education in Ayurveda. And so we help people to understand, how did I get where I am? What was the trajectory of my illness? And that helps them commit to change, and it helps them be more compliant with change and more adherent with the treatment protocol. So for instance, I did a small study of Ayurvedic medicine for obesity and weight reduction, and we did do an Ayurvedic yoga therapy component where there was yoga therapy 3 times a week, and then they were requested to practice again at home. They also met with me twice a month to go over their diet. In Ayurveda, we will look at cravings and avoidances as part of dietary modification. We want to understand, why is it they're craving certain things. So a person with a kapha aggravation may crave carbs or sweets. And so the causality in Ayurveda is bidirectional. As we reduce kapha dosha overall, cravings for carbs and sweets will also decrease. And likewise, if we decrease the intake of carbs and sweets, kapha dosha will be reduced. So it's lucky that way, in that no matter what you do, you get the benefit on both ends. And so we did yoga therapy, we did dietary modification. We also want to look at sleep, because when sleep quality is poor or sleep duration is insufficient, again, it's difficult for the body to shift and make change and sustain change, because it's too busy really attending to this very central concern of rest. And so we need to attend to some of those basic items. We also look at the psycho-emotional condition of the patient. Ayurveda is very good at addressing psycho-emotional kinds of circumstances and reframing those so that the patient can become unstuck, basically.
Excellent, excellent. Let's do a couple of other things. So let's bust some myths. I love doing that. So myth number one, I hear all the time. Oh, you have to be from India, or you have to understand, like you have to be yoga practitioner to benefit from Ayurveda, right? So how would you respond to that?
Absolutely not. Ayurveda is accessible to everyone. The principles themselves are very basic. Ayurveda is a 5-element system of medicine. So, in that sense, it's similar to Chinese medicine, but the elements are different. So, the elements are air, space, fire, water, and earth. And the theory is that our environment is comprised of all these elements, and so are we. So it's our interaction with our environment that either promotes balance or imbalance. And once you have that basic understanding, you're good to go. You don't need to have any other kind of cultural information to proceed with the paradigm.
So
And
air, water,
air,
fire,
space,
space,
fire,
uh-huh,
water, and earth.
and earth. Yeah. So
Yeah.
that, well, for me, it's very personal because, in Sufism, the way I practice, with our main practice is just that. We call it elemental breath, and exactly this 5 elements is what you're breathing. So I think there's a lot of cross reference from all the traditional modalities, and I love how in Ayurveda this is it's so honored, and so it's a practice at the core. Unfortunately, sometimes what we see with Chinese medicine, there's been a lot of reductionistic process. Just put acupuncture needles in me and I'll be fine. And there's this idea of removing actual core essential base of some of these approaches. So, all right, myth number 2, if I take any Ayurvedic herbs, I'm going to get poisoned with heavy metals. By the way,
Oh,
that's
that's
like,
a good
that's
one.
like
Yeah,
a big
so I
one.
have written an article about this, and it's very important to understand. So that original study that was done by a colleague and friend of mine was really a study of consumer behavior. It was a study of what do people purchase on the internet without the benefit of any Ayurvedic practitioner giving them advice. And those things should not be, those medicines, there are medicines in Ayurveda which have purified heavy metals as part of their component, and also some kinds of ash, like the ash of shells and things of that. That's a very kind of specialization within Ayurveda. So Ayurvedic practitioners trained in the West are not taught those things for the specific reason that we have various regulations and things that don't allow us to sell those medicines in the United States. But that is one issue. So an Ayurvedic practitioner practicing in the West will never prescribe those things. Number one. But number two, a lot of what was misunderstood in that original study that kind of propagated that myth was that there's at the time there was still leaded gasoline being sold in India. So really it was about environmental contaminants and environmental pollutants on plant matter more than anything else. And so that was really an issue of sustainability, agricultural sustainability and practices of cultivation that are more related to having resource deficits in countries that are not as developed, which is a much larger conversation. But yes, you're right. That is very much a myth. Not the case at all.
All right, myth number 3, my favorite one. Oh, I don't need any Ayurvedic practitioner. I'm just going to go to Deepak Chopra or some other one weekend workshop. I'm going to learn it all, and then I'm going to cure my health completely because it's such a simple system.
So when you learn the 5 elements and you learn how they comprise the 3 doshas, air and space is vata, water and fire is pitta, and water and earth is kapha. So that after those things, there is no more simplicity. From there, it mushrooms into a very complex system. And I am very, I very much caution people against what I call kind of cocktail party Ayurveda, where people say, oh, my dosha is this. So I think, I've taken the test, the little
And
written.
by the way, I've been witness to this, like I go to this one weekend seminars and somebody will do introduction to say, oh yeah, you can learn all this by the end of this seminar. I'm like, really? It's a 5,000 year system. Like I'm not gonna, I can listen to some of the basics, but I'm not gonna pretend that I have any sense. And by the way, I love Deepak Chopra. I just meant that he's quite known for his program around this and training coaches and stuff. But there's this assumption often that people can go and in a short period of time master this topic and then either become patients themselves, providers, their own providers, or they can, actually work with somebody else. And I had some experiences from my patients working with some Ayurvedic health coaches who are clearly undertrained. And I think the reason for that is that this exact point that you're making, it's an extremely complex system. It's not to be appreciated in its complexity. And I mean, there's a reason why people go to medical school for 4 years, right? So it shouldn't be any different in that sense. And I think even more important, I think there's a lot of overall underutilization of Ayurveda in the US, and I never fully understood why. So we're kind of done with the myths, but I want to hear your take on, TCM is all over the place. You can find acupuncturists on every block on this town, but like you really can count on fingers the amount of Ayurvedic practitioners in our own area. So why do you think, like, what is the sort of undercurrent here? Why do we have not had this profoundly effective and extremely sophisticated system not to be really represented more in US?
Right. So I think there are a number of things. Three things come to mind. I mean, the first thing that I'll mention is that the three certifications in Ayurveda are varying scopes of practice, varying levels of training, and so varying capacity of what the practitioner can provide. So there's Ayurvedic Health Counselor, which is 750 hours of training. There is an Ayurvedic Practitioner, which is 1,500 hours of training. And then there's Ayurvedic Doctor, which is 3,000 hours of training. And so you do have a system where at the level of Ayurvedic Doctor, which is a full scope of practice, you have somebody who's gone to, those 4 years of medical school, basically. And so that full scope of practice, as I said, is comprehensive primary care. But when Ayurveda was first introduced to the West, it came on the coattails of yoga. So I think it was kind of downplayed in that sense and not understood as a full medical system originally. I think it has helped that we have now built an infrastructure of training and credentialing and certification and even accreditation of schools within Ayurveda, but that has taken some time. As you mentioned, Chinese medicine was really, in order to become palatable in the West, has really been reduced to a significant degree. I think that one issue is licensure. Ayurveda now has national exams for the 3 levels of practitioners. So national exams are the thing that really precede licensure. So it is kind of, a pathway to licensure. And so that will happen eventually. And that will make things, I think will make Ayurveda more available in the mainstream. But many very useful, comprehensive healthcare systems really are not in the realm of licensure. There are various other levels of accountability and regulation that can happen. And I think that we just need to become more open to these alternative methods. The third thing is that Ayurveda is a spiritually oriented system of medicine. And I think for many years, there was not that recognition of this spiritual aspect of health and healing. And for myself, I use a really practical definition of spirituality, which is a sort of ritualized forms of self-awareness, understanding of our relationships with self and others. What is the structure of our relationship to our environment and the natural world? To me, that all falls under the umbrella of spirituality. And I think that that understanding has now progressed dramatically. We now, in all integrative medicine programs, have discussions of people's sense of purpose and meaning in life as a very important part of healing and well-being. So now that we're more oriented around whole person health and patient-centered outcomes, we have begun to include kind of a spiritual orientation towards well-being and quality of life in the integrative medicine repertoire. And that opens the door for Ayurveda for its complete practice. And it doesn't have anything to do with religion, nothing like that. It's just really about understanding that health goes beyond the squarely physiological orientation.
So hopefully the licensing is coming. I think I think, as you pointed out, that's probably what's going to dramatically expand the amount of Ayurvedic practitioners in the country. I think something not being licensed, unfortunately, often in US gets this kind of a sense, oh, it's not valid, which, you know, that has nothing to do with that. It's just simply the processing of the particularities of a given field. So, but you know, it feels like we can talk about this for for hours, but I know I when I started this series, I decided we're gonna be very short because I think that we value our patients' time. So, any final closing thoughts before we tell people how to find you?
Just that Ayurveda is available to everyone. It treats all types of conditions throughout the lifespan, from childhood to elders. And there are so many aspects of Ayurveda that you can, in some ways, choose how to emphasize and prioritize the aspects that are most important to you. And yeah, I just hope that people will come and try it out.
My closing thought is, just for that short period of time, a few months we've been working together, I have learned so many things from you, and just realizing how often we neglect, as comprehensive providers, we neglect certain areas that are so basic and simple, and yet if it's not in our radar of understanding, we won't be able to see it. And so yeah, and I have referred a number of patients to you. Some of them did really, really well. And so people can find you on our website, www.gwcim.com. Our phone number is 202-833-5055. Jennifer, you have your own blog, your own Facebook page, and you think people can find you individually?
Not really.
Okay, so gwcim.com. We will post this video on YouTube, and then we'll put it on our website, and then we'll share it as well on the Facebook.
Great, thank you so
So
much.
stay healthy, everybody. Perfect time, I think, to do this talk today. Well, actually, we're getting cold again today. It felt like the spring was here, but apparently.
Yeah, Ayurveda is great with seasonal routines. So
Right.
change
So
seasons
next time you come back, we'll do something a bit more practical. And
okay.
also those of you who are listening, Jennifer is a regular visitor at our Friday PM GW Office of Integrative Medicine, AIM Health Institute meetings. And so she watched, there's some recordings of her talking about particularities of specific seasonal treatments, like you did one for the winter. Maybe we'll do one for the spring and then one for the summer.
Okay.
Stay tuned. Bye,
Perfect. Thank you
everybody.
so much. Take care. Bye-bye.